As a patient with prostate cancer myself, I'm here to tell you it's a lot. It's no joke. No cancer is. But what can be even more anxiety-provoking is the thought of what the treatment's going to be, even more so than receiving the diagnosis itself. A team focusing on benign prostate care has shifted its focus to game-changing technology in how we might approach the treatment of prostate cancer. Take a look at this.
My father and my grandfather both had prostate cancer, so I had a pretty thorough understanding of what was involved with cancer. I was aware that because of my genes, there was a likelihood I would get prostate cancer. I knew several treatment options. When I was told that I needed another biopsy in 2024, I asked my daughter, who was a breast cancer surgeon at Endeavor Hospitals, to find a urologist at an Endeavor Hospitals. When I learned that the aquablation procedure could shrink my prostate, and in addition to removing the cancer so that I wouldn't have to have as many tests as often, I thought, well, let's give it a try. It was everything that I expected happened. And I was happy to be part of a clinical trial because from a humanitarian obligation standpoint, I felt like it would help advance the science, and if it worked, it will help thousands and thousands of people in the future.
To share more about the revolutionary work they are doing, here is Philip Charlesworth. He's consultant urological surgeon. Philip, thank you for being here. So we had spoken to the team earlier about treatment with the ablative therapies for BPH, hypertrophy of the prostate. Tell me what this is and why it's different.
The technology is the same.
Water.
But using two types of imaging to map the prostate. So live ultrasound and an endoscopic view. Yeah. And then to map the exact bit of the prostate we want to remove, and then cold water jets come out through an instrument that goes through the penis into the prostate to then remove that bit of prostate.
Is it surgical? Are you anesthesia during the procedure?
General anesthetic, yeah. And that is a procedure for benign prostatic enlargement.
In the past, prostate cancer was either radiation, well, it still is, or taking out the whole prostate.
Yeah.
Right, provided you don't have metastatic disease.
Now, prostate cancer often grows in the peripheral zone of the prostate rather than the transitional zone of the prostate.
Mine was weirdly in the middle. This happens.
Yeah.
Yeah.
The nerves and the muscles that are important for control of urine and continence, and the nerves that supply erections and sexual function, are all on the outside of the prostate. The robotics that has been around for 20 years is about going in through keyhole techniques nowadays, and it's about high precision going in and trying to remove the whole prostate from the outside. But still, that brings into play the nerves and the muscles, and therefore the consequence of it.
You're cured, effectively.
But what are the side effects? What are the irreversible side effects associated with taking the whole prostate out? The theory being is like, how can we do that with less side effects for that patient? Principle being that actually, if we can remove the whole prostate, or 95% plus of the prostate, including the cancer, then can we do less harm to that patient that's going through that cancer journey?
So you're just leaving the shell.
Just leaving the shell from the inside out.
Interesting.
So this is men with localized prostate cancer. So men, not T3 being growing outside the prostate. The patients that don't fit in the trial are patients which are clearly locally advanced disease.
Yeah.
There are other excellent treatments for those. That's not really what we're looking at. We're looking at men with localized disease.
It's so interesting to me. Prostate cancer used to be this sleepy condition that we couldn't do much for it. Now it's one of the most exciting areas of treatment in oncology.
Prostate cancer is a very strange cancer because the lower grade prostate cancer moves glacially slowly. So we have time and there's no need to panic.
Well, thank you very much, Philip. Appreciate it. If you're interested in learning more about this, or to even see if you're eligible for the trial, head over to Water for PCA. That's water, the word, number 4, PCA.com. Future of prostate cancer treatment could look very different, and this is where it's starting. I'll tell you that. Don't go anywhere.